Hello, welcome back to the series of linguistics talks. In the previous discussions, we have explained concepts such as discourse analysis, pragmatics, semantics, and the interrelation among these components of language. Today, as you see, the topic is language and the brain, or neuro-linguistics. Today we discuss the location of the production and comprehension of language as a normal process. Also, the difficulties that might occur during the comprehension and production of language. As you see here, the topics, the topics are Broca's area, Wernicke's area, neuro-linguistics, SLIPs, localization, aphasia, and critical period. These are the key words. The first topic is neuro-linguistics. What is neuro-linguistics? It is the study of the relationship between language and the brain. That is a recent discipline, recent area of study which deals with the normal and abnormal comprehension and production of language components such as vocabulary, grammar, morphology, phonology, semantics, syntax, and pragmatics. So neuro-linguistics is the study of the interconnection between human language and human brain. There are some key terms in neuro-linguistics, basically focusing on the idea of how language is perceived, how language is comprehended, understood, and how different components of language are produced. So the structure of the brain, human brain, or the gray matter, is under analysis. There are two terms that are paramount. One is Broca's area and the other is Wernicke's area, as you see here. So what is Broca's area? Broca's area is the frontal part of the brain that is called the anterior speech cortex, which is actually involved in the production of language. This finding was first used to argue that language ability must be located in the left hemisphere. There are two hemispheres, left hemisphere and the right hemisphere of the brain. So language ability is located in the left hemisphere. And since then, it has been treated as an indication that Broca's area is crucially involved in generation or production of spoken language. In other words, Broca's area of the brain is responsible for language production. What about Wernicke's area? Wernicke's area is by definition the posterior speech cortex, or it is located at the back of the brain, not the front. So, and it is responsible for the comprehension of language. So any comprehension difficulty or problem can be attributed to the Wernicke's area. So this finding confirms that the left hemisphere, the left section, location of language ability led to the idea that Wernicke's area is part of the brain fundamentally involved in the understanding of spoken language. To be more precise and to be accurate, Wernicke's area is the posterior speech cortex, which is responsible for the comprehension of spoken language. The next important topic in neurolinguistics, or the relationship between language and the brain, is the localization view. What is localization view? The word might have been unfamiliar to you, but I make it easy to understand. So, the localization view is specification of particular functions in specific parts of the brain, such as left hemisphere and the right hemisphere, and their functions. Also, Broca's area and Wernicke's area. These specifications are referred to as the localizational view. So the brain activity is involved in hearing, understanding, saying. The words are locally specified in your brain. So every section of your brain, basically, based on localizational view, is responsible for certain particular activity. Some part of your brain responsible for musical activity, some parts for mathematical activity, some for physical activities, some parts for artistic activities, some for motor skills or just your physical activities. Also, some parts of the brain responsible for appreciation of architecture, appreciation of language production, and language comprehension. So that is a modularity theory, that different sections of your brain are specified for absolutely distinct functions. This view is also called domain specificity, meaning that the different distinct domains or areas of your brain are specified for certain particular functions or actions. So that is the localizational view of language and the brain. However, it may be pointed out that the linguistic comprehension and the linguistic production is not always perfect. There are always vulnerabilities, weaknesses, accidents, damages to the brain. So when people go through accidents, like car accidents, certain parts of their brains is damaged or influenced or negatively influenced. If the Broca's area is damaged, the consequence is impairment or problem with the speech production. However, if during the car accident the posterior or the Wernicke's area of the brain is damaged, the comprehension of language is undermined. The comprehension is basically worsened. So people who have got car accidents might have a disability in understanding the language, but they might be able to produce the language because of Wernicke's and Broca's aphasia. So and also here we got the slips. There are different kinds of slips, like slips of tongues, slips of ear. Slips are problems, are inadequacies, are flaws. So any kind of slip, S-L-I-P, any kind of slip basically indicates a damage or a problem in the brain. So if the slip is related to your tongue, it's called a slip of tongue. For instance, is a kind of aphasia that is people have got difficulty like stammering or stuttering. Examples of slips of the tongue. Slips of the ear is difficulty with hearing. That is more related to the larynx area. So by definition, any difficulty, any problem related to the production of the language is a kind of slip, or any problem with the comprehension of the language is attributed as slip, S-L-I-P, by different kinds of slips, slips of comprehension, slips of production, brain slips. One of the interesting ones is basically the slip of the tongue, or so you might see that people make mistakes speaking, and this actually is a kind of irregularity and problem in speaking or in listening. A very, very significant topic is aphasia. So what is aphasia? You have an aphasia here is that any kind of slip is kind of aphasia. Any kind of disorder, language difficulty is referred to as aphasia. And aphasias are divided into two kinds, generally. Comprehension aphasia and production aphasia. So aphasia is an impairment of language function due to localized brain damage that leads to difficulty in understanding or producing language or linguistic forms. So the most common type of aphasia is the result or the repercussion of a stroke. When blood vessel in the brain is blocked or burst, it's referred to as stroke, S-T-R-O-K-E. So this happens through injuries, and it actually leads to language disorders. So different kinds of aphasia. One is Broca's aphasia, the other is Wernicke's aphasia. Broca's aphasia, as already mentioned, is an impairment or a problem in the production of language. Wernicke's aphasia, by contrast, is an impairment or a problem in comprehension of the language. Also, there are different kinds of aphasia. Agrammatica is disability, is a kind of aphasia which leads to disability to use grammatical sentences. A means without. That's the reason why we call it agrammatica or agrammatic speech. Anomia is that A again is without. The problem with proper names, nom means name. Anomia is aphasia that is related to a disability to use proper names appropriately. That is anomia. In addition to aphasia, we've got the important concept of the critical period. So the apparent specialization of the left hemisphere for language is usually described in terms of lateral dominance or lateralization or one-sidedness. So to specialization, I want to reiterate or emphasize this. Specialization of left hemisphere of your brain for language comprehension and language production is referred to as lateralization. So what is lateralization again? Specification of the left hemisphere for language in your brain. What are the other names employed to refer to the same concept of lateralization? Lateral dominance and one-sidedness. So there is relationship between the concept of lateralization and the critical period. The critical period is the period at which the lateralization takes place. It's probably from around 4 or 5 to 13 years old, and that is the most appropriate time for language learning because the lateralization is taking place. So that is called also the sensitive period. So what is the other name for critical period? That's sensitive period for language learning and language acquisition. So if anybody learns the language in the critical period or lateralization period, one-sidedness period, or lateral dominance period, the likelihood of obtaining native language proficiency is very high. Conversely, learning language after adulthood or late, when people are considered senior citizens, reduces the chance of learning a language like native speakers, specifically in terms of pronunciation. They develop accents, foreign accents, and you can recognize that they are not native speakers of language. So what is the significance of critical period or sensitive period? This period is the best time for learning any foreign language. And after that, because the plasticity or flexibility of vocal cords and the brain functioning is reduced, hence acquiring a language without a foreign language is very, very difficult. In other words, the flexibility of the vocal organs dramatically decreases after the critical period. And also, the other reason why learning a language after the critical period is a difficult process is psychological barriers. After critical period, after the age of, for instance, 15, or after the age of 13, for instance, to be more precise, human beings develop some psychological impediments, psychological barriers like shyness, like lack of demotivation, like panic, like stress, like fear of unknown. These negative or anxiety, these negative psychological constructs destroy the chance of learning a language properly. So after the critical period age, these psychological and physiological problems prevent individuals to obtain native language proficiency. So let me wrap up the whole discussion today. Today we talked about the relationship between language and brain. We discussed the discipline or the area of the neurolinguistics. As the name suggests, neuro is like your nerves, your nervous system, and your neurons, and linguistics is the study of language. So that's an interdisciplinary area elaborating on how the brain functions in the production and comprehension of language, and what areas of the brain are responsible for comprehension of language, and what areas of the brain are responsible for production of language. So the term Broca's area refers to the anterior or frontal part of the brain, and Broca's area is specified for production of language or speech. The other area, that is the posterior area of the brain, the posterior area, the back of the brain, is Wernicke's area, which is not responsible for production. Rather, it is responsible for comprehension of language. So any damage to Broca's area or the frontal part of your brain in accident leads to production problems. You cannot basically speak, or your speech is not understandable. However, in the car accident, a damage to the posterior area or Wernicke's area leads to a problem in comprehension. So you talk to the person who is injured and he cannot even understand his or her own native language. And that's sometimes very bizarre situation leads to the people. They cannot understand the language because the Wernicke's area is damaged, but they can speak. So they don't understand you, but they speak to you. And they just say something. They say irrelevant statements. And this is the job of speech therapists. Speech doctors responsible or specialists responsible for removing the problems. So in case people have got problems with comprehension or production, stammering or stuttering, some people are stammering. For instance, they say please, stop, that is a kind of stammering. So these people need to see the specialist. And this is production problem. It's about Broca's area. So these specialists provide the patient with some exercises, so some repetitions, some games, some rhymes and rhythms to repeat over and over again. For example, they ask the patient say, the main train from Spain will domain the main rain, something like that. So these are called tongue twisters. Tongue twisters are used to basically try to remove the problem. So again, we talked about critical localization. Localization, by definition, is the specification of functions to specific parts of the brain. So where the musical intelligence is, where the musical section of your brain is. That is domain specificity hypothesis. That the specific domains are attributed to certain part of your brain. What part of your brain is related to mathematics? So that's the reason why we have multiple intelligences. And some people are amazing in mathematics, but they are horrible in humanities, and the other way around. This is called multiple intelligences. Some students are very good in English and in languages, but they are terrible in mathematics and physics. Some students of engineering, that is multiple intelligence. Specific part of the brain that is responsible for engineering is basically working properly, but the part related to art is not working, does not have the potential. So the theory of multiple intelligence approves localization period, signifying that different sections of the brain are responsible for different activities. Again, the concept of aphasia was elaborated on and explained. Different kinds of aphasia. Broca's aphasia is for production. Aphasia is refers to as any difficulty, any disorder in language production or comprehension. I said that aphasia could be agrammatica, you have a problem with grammar, anomia, problem with proper names. It could be related to comprehension, production, and I talked about stammering and stuttering. So we come to the point that neurolinguistics, or language and brain, encompasses or includes normal production and comprehension of language alongside abnormal production and comprehension of language. I think I have supplied you with relevant important information. That's a brief, succinct summary of language and brain, or neurolinguistics. Thanks for your time and attention. I will get back with more linguistics series of talk next time. Look after yourselves and see you later.